Good day. This is Phil Larson with Solom Insurance, and we're going to talk today about Medicare. You've been wondering how all of that stuff works, right? So, real quick, let me introduce you to myself and Solom. Solom means life foundations. It's Latin for soil or foundation. So, we're bringing you an unexpected service today, not selling you anything, just going to talk to you about Medicare and how it works. This is Education 101. So get yourself a cup of coffee. Maybe you've already got a checklist and you sat there and said, I'm getting ready to retire. I'm 64 and 65's coming, or I'm 66 and now I'm ready to do this thing. And you've got some things put down together and you've made a list out and said, well, I got this of my pension and my 401k, my cash stash and my home equity and my final expense insurance and big old other life insurance and will and estate plan. I don't know what you've done. I'm sitting here in my stationary RV. It's one of my offices. I'm not retired yet, but I have the fluidity, the ability to work from where I want to work. So I might be working at home. I might be working out here in my cabin. I might be working in your living room. I might be working anywhere. That's the way I like to live. How do you like to live? What are you planning to do? Somebody tell me what's the difference between a financial planner and a good insurance retirement planner? And the answer is a financial planner is there to get you to retirement, get that money ready and get everything ready to go so you can retire. A good insurance planner and retirement planner, like what I do, is help you live it. Now you need to live it out. Now you need to have some fun. So I'm going to throw away that piece of paper, and maybe you've got one there, but I'm not going to be writing things down. I'm just going to be talking to you about this. Again, Solom is about an unexpected service. That double leaf has a meaning. We come alongside and help you get the information you need to make an informed decision. Much of our profits go to three organizations. Solom CTI, which helps people who are struggling in life, fixing fractured families. We train hundreds of people every year. The second one is the National Association for Grandparenting, grandkidsmatter.org, grandkidsmatter.org. And the third one is the National Center for Fathering, NCF, or fathers.com. We love families, so that's why we do what we do, and we're able to share out of what we do with those organizations. I'm Phil. That's my address. Don't get confused. You can find me. 508 Tumbleweed Drive is our home office. It's also my home. And then Phil at solominsurance.com. Email me. Love to answer any questions. That's my cell phone, 405-388-8037. Why in the world would you want to call some hotline number that you don't know who's going to talk to you? 405-388-8037. You're going to come directly to me. I answer my own phone. solominsurance.com. You can pick up information. So today we're going to talk about Medicare basics. That's what this is all about. You got to that point in your little planner where you're checking things off, and you got to, okay, well, health insurance. And somebody told me that was free. Boy, did you get at any rate, it's not free. You have been paying all your life into Medicare insurance. And so we're going to talk about that and what that gives you. And there's premiums involved depending on what decisions you make. And you need to know about those decisions. And there's deductibles and there's co-insurance and there's copay, all these different things. And there's limitations as to what it covers. It doesn't cover everything forever. You want to know about Medicare because I want you to have a great retirement from 65 on. You're going to get a few specifics. We're not going to cover everything. We'd be here for decades. That's why you talk to me and hire me, and so we can talk to you. Schedule a talk time on areas of interest. That's something I'd love for you to do at the end of this. Schedule time to talk back with me and say, hey, Phil, let's talk about this and this and this. We're going to talk about Advantage. We're going to talk about supplements. Prescription drug plans, PDP. Supplements are also called Medigap. Final expense. We're just going to cover a few things here today. There's a lot of stuff. Now, final expense is not part of Medicare, by the way. I want to make that clear, and it just lets you know that we can talk to you about that. So here's an Advantage plan. Here's basic Medicare. Here's Medicare, Medigap supplements, and prescription drug plans. All of these things are called Medicare. And the Center for Medicare and Medicaid Services, CMS, is run by the federal government. Advantage plans, basic Medicare, Medigap supplements, prescription drug plans, all of that equals Medicare. Now, everything you know about medical major, major medical, Affordable Care Act, all of that stuff, would you just throw it out the window? Hey, could you do that for me? Just throw that out the window. What's basic Medicare? It was signed into law in 1965 by President Johnson. Medicare provides health insurance to Americans aged 65 and older and to younger people with certain disabilities or health conditions. It consists of Part A, B, C, and D. Now, this is just going to be a few minutes, but if you want to get your coffee like I do, you may want to go get your coffee, sit down, get that notepad back here, make a few notes, write some questions down that you can get back with me and say, Phil, what about this? What about this? Because, we're doing this over the however you're doing it, over your phone or your tab or your computer. Maybe there's 2 or 3 of you sitting there going through it. You've got some questions, and I'd love to join in and answer those questions for you. A, B, C, and D. Well, that sounds simple. Wait till we get into this. When can I sign up? Basic Medicare. There's an initial enrollment period. You can sign up when you're first eligible for A and B. People turn 65 or older. This is a 7-month period that begins 3 months before you turn 65, includes the month you turn 65, and ends 3 months after the month you turn 65. That's that initial enrollment period, 7 months. If you sign up for A and B during the first 3 months of your initial enrollment period, your coverage start date will depend on your birthday, right? Can't start on the first day of the month. That means it would roll back. Your Part B coverage will start the first day of your birthday month, if it isn't on the first day of the month, right? So A and B, we haven't talked about what A and B is yet. We're going to get to that. Take a breath. When can I sign up? If your birthday's on the first day of the month, your coverage will start the first day of the prior month. To simplify your Medicare experience, make sure to be signed up for A and B before the month you turn 65. Let me make that really clear. If you want to simplify your Medicare experience, make sure you're signed up for A and B before the month you turn 65 if you want to take it on the month you turn 65. And A is just there. There's no cost. Go ahead and take it. B, we're going to talk about it. If you're still working, you have some decisions to make. General enrollment period. If you didn't sign up for Part A or B when you were first eligible, you can sign up between January 1 and March 31st each year. Your coverage will begin July 1. You may have a higher premium. Now, if you didn't sign up when you were first eligible, you can sign up any year between January 1st and March 31st. Coverage begins July 1st. Special enrollment period. Medicare coverage begins the month after Social Security gets your completed request. Usually, you don't pay a Part B late enrollment penalty if you sign up during a special enrollment period. We're not going to go through all of those today, but if you want to know about it, if you think you have some special situation, let me know. Some people turning 65 or older need to sign up for A and B. If you're not getting Social Security benefits, you won't get any enrollment information from Medicare. You will need to call Social Security at least 3 months before you turn 65. They're not going to call you. You have to call them. Medicare Part A, hospital insurance, right? You got this down, A, B, C, D, basic Medicare, Medicare Part A, hospital insurance. Inpatient care in hospitals, skilled nursing facility care, not custodial, hospice care, home health care. Deductible for Part A 2019 is $1,364 per benefit period. Now, what's a benefit period? You'll learn that as you go along here, but a benefit period says you go into the hospital and there's 60 days in there, right? A benefit period begins the day you go into a hospital or skilled nursing facility, ends when you've been out for 60 days. If you go back into the hospital after 60 days, then a new benefit period starts and the deductible happens again. That little quote came right off of the CMS site. The premium is free if you paid taxes for 10 years, right? Premium's free. This is hospitalization. Hospitalization. Got it? Medicare Part B, outpatient insurance. A, hospitalization. B, outpatient insurance. Services from doctors and other healthcare providers, outpatient care, durable medical equipment, some preventive services. Deductible for Part B is $185 per calendar year. Premium is $135.50 unless income is above $85,000 for an individual or $170,000 for joint. Social Security, if not currently receiving, right? So Part B is that doctor stuff, outpatient care, durable medical, some preventive services. Deductible is $185 per calendar year, and there's a premium. There's a monthly premium, $135.50. Everybody gets an opportunity to pay for that, unless you have some special circumstances. Maybe you're under Medicaid or other options there. Again, talk to me. We can talk about that. Basic Medicare. What's not covered under A and B? Hospitalization and major medical. Long-term care is not covered. Custodial care is not covered. If you don't have long-term care insurance, it's not covered. Routine dental or eye care is not covered. Dentures are not covered. Cosmetic surgery is not covered. Acupuncture is not covered. Hearing aids and exams for fitting is not covered. Right? Need to know that. Get that in your head. If any of these things are important to you, they're not covered under basic Medicare. Right? Medicare consists of basic Medicare, prescription drug, Medigap supplements, Advantage plans. Let's talk about Advantage plans. Part C, we know what Part A is. Part B, let's talk about Part C, is a Medicare Advantage. Medical plans offered by private insurance companies includes all the benefits and services covered under Part A and B. Usually includes prescription drugs, but not always. You need to make sure you get into a plan, if you want that does that. Comes in the form of an HMO, a PPO, an HMO point of service, or a PFFS. You go, man, what is all that stuff? Well, you might know what an HMO is, right? An HMO is that health maintenance organization. You're assigned to a specific doctor, and he's your primary physician and oversees everything you're doing. Or you're assigned to a PPO. You may have had that in your work career, that you have a network of providers in your area. It's important to remember this as we go through here, because your retirement plans, you need to know what selections you make up front based on what you want to do in retirement. Do you want to live in one particular area? Do you want to go into other areas? You want to make well-informed decisions. Do you want to travel a lot? Your decisions on your Medicare will influence those big time. Must adhere to a network for services. Medicare Advantage, private insurance companies working with the government, medical plans. Joining Advantage plans, joining or leaving the plan when you're aging in due to medical disability. Open enrollment is October 15th to December 7th. Wow, you're going to see so many ads on television, late night and radio and all this, and stuff starts showing up in your mail in September about that open enrollment, which applies, by the way, to Advantage plans. Special enrollment periods, moving out of area, doing different things can get you a special enrollment period. Going to original Medicare between January 1st and February 14th, right? New for 2019, right? An open enrollment January 1st to March 30th, moving from a Medicare Advantage with prescription drug to a different Medicare Advantage with prescription drug, right? Now follow these steps if you're already in a Medicare Advantage plan and want to switch. To switch to a new Medicare Advantage plan, simply join the plan you choose during one of the open enrollment periods. You'll be disenrolled automatically from your old plan when your new plan's coverage begins. Again, I threw that in there right from the CMS site. Just some specific information as you're planning this. A, major medical, B, healthcare, C, an insurance company coming in and helping you run your A and B. And a lot of times we'll have some extras. Maybe a monthly premium. There may be a deductible. There's co-pays and co-insurance. It depends on whether you're in network or out of network. Once you meet the yearly limit, you pay nothing for covered services. And those yearly limits are significant. So you need to know what plan. We're not talking about any plans here. We're just talking about Medicare insurance in general. Okay? Advantage plans, prescription drug coverage. They may be included in the plan. They may have a deductible, may have copays. You need to know your plan. Right? Basic Medicare, Advantage plan, Medigap supplements, prescription drug plans. What's next? Medigap supplements. Supplements help pay for some of the costs Medicare approves but does not pay. Medicare supplements are standardized, which means policies must follow federal and state law. All plans are identified by the same letter. Plan F, G, N are the same. You'll be choosing a company and choosing a price. Additional facts. You must have Parts A and B. You will pay a monthly premium in addition to Part B premiums. You must purchase a Part D plan if you want prescription drug coverage. It's not going to be in a Medigap supplement. When do I enroll? Most people enroll when they obtain Medicare Parts A and B in that 7 months. You have a 6-month open enrollment, which starts in the beginning of the month of your birthday, right? May be declined based on health history if you do not enroll in an open enrollment period. You cannot be declined if you enroll in this first open enrollment period, but you may be declined later based on your health if you do not enroll. Do I pay premiums? Community rates. Everyone pays the same regardless of age. And issue age. Premiums is based on your age at the time you entered the plan. Attained age. Premium will increase each year based on the current age at the time. You want to know if getting into a Medigap supplement, right? And there's reasons that you would want to choose this over the Advantage plan, right? If you want to travel and do things, you're going to move around a lot. Medigap supplements are not restricted to a network in an area. Anyone who accepts Medicare accepts Medigap supplements. So you're not locked down to where you're at and where your doctors are. Premiums may increase each year due to medical increases in the plan. You want to get a good, I encourage people, and you make your own decisions, to get a good solid company that can absorb increases. Medigap open enrollment period, a one-time only, again off of CMS, 6-month period, when federal law allows you to buy any Medigap policy you want that's sold in your state. It starts in the first month that you're covered under Medicare Part B and you're 65 or older. During this period, you can't be denied a Medigap policy or charged more due to past or present health problems. Some states may have additional open enrollment laws under rights under state law. Right? You getting this? Medigap supplements. And you thought ABC, and we haven't gone to D yet, was simple. How about Medigap has A, B, C, D, E, F, G, L, M, N? No, A, B, C, D, F, G, K, L, M, N. And in 2020, F goes away, but it's 2019, so let's talk about that. Or you may have already been in an F and have some questions about it. So here's a little chart that says what's covered under these plans. No matter which insurance company you buy it from, the plan is the same. Your premiums are going to be different based on their ability to do things. So a lot of people choose F because look at this, man, it's 100% of everything. It covers your co-insurance and your hospital cost, right? Medicare B, your co-insurance and your co-payments. It covers your blood. It covers hospice care co-insurance, skilled nursing facility care co-insurance, Medicare Part A deductible. Wow, remember that $13.64 per period? There it is covered. Medicare Part B deductible, Medicare Part B excess charges, foreign travel emergencies. So everybody goes, oh, here, well, yeah, that's probably going to be a higher premium than the other ones. So you can move it out. And G covers all those things, but it has a $185 deductible. And N over here, people look at sometimes because it does a lot of this, and it does a 15% on these excess charges down here. So there's, you want to know all this. I'm just giving you an overview. Some people might pick an A down here. They just say, hey, this is what I can do. This is what money I have in my budget. You're going to pick something that fits your budget and your lifestyle and where you figure things are going to go in your life. Always remember when you're picking your Medicare choices, think about where you might go in life, not just where you are today. So Medigap supplements. Original Medicare, Part A is premium free, Part B is $13.50, Part D average is $36.60. That's that prescription drug plan. We haven't talked about that yet. Plan F would be $150. That's all of that 100%, deductibles and excesses. A total of $322.10. That's probably significantly cheaper than what you're paying for your corporate health care, or you might not even have good health care. And if you're on that government health care, it's definitely more expensive than that. All right, so Medicare Advantage Part C, right? This would be under a supplement plan. Part C would be A is premium free, B is $135.50, the same Part C. is going to be $0 to $184. It's all going to depend on what options you pick in it and where you're at and your zip code. That's amazing. Total equals unknown. It depends on your frequency of use. If you go to the hospital a couple of times, that's 1364 times 2. That's $2,700. Wow, that's a lot of money. That's more than a Plan F over here. So, and if you got a lot of prescription drugs and you know this Advantage plan, we're assuming that you picked an Advantage plan that has a prescription drug in it. If you didn't, you're going to have prescription drug coverage on top of that, right? Original Medicare, no copays, coinsurance, or deductibles for Medicare approved procedures. No networks. That's with the supplement. Over here under Advantage, you're responsible for all your copays, coinsurance, deductibles. You must use a network. Out of network will cost you more. You know somebody, right? Who so well, I'm going to visit my kids, but man, I got to get all my doctor visits before I go visit my kids because I can't get any health care there because I'm under what? An HMO or a PPO Medicare Advantage plan. They were under a supplement. No matter where you bought that supplement, it spends across the United States. That makes sense? No matter where you bought it, it spends across the United States and even has some travel emergency built into it. Just understand this system. It's a system. You can understand it and use it to your advantage. So we've talked about basic Medicare. We've talked about Advantage plans. We've talked about Medigap supplements. Oh, prescription drug plans, right? Let me take another sip of coffee. Medicare offers prescription drug coverage to everyone with Medicare. There are two ways to get Part D: Medicare prescription drug plans, standalone Medicare private fee for service, or Medicare Advantage plans. You get Part A, B, and D through these plans, right? It can be either way. When do I join, switch, or drop a Part D plan? When you're aging in, 7-month period, here it is again. Due to Medicare disability, 7-month, 25-month of receiving disability benefits. Open enrollment October 15th to December 7th. So it has the same open enrollment as the Advantage plans. When do I pay? Your actual drug plan cost will vary depending on your RX on the plans on the formulary list, right? You've done that when you've had insurance with the company. Certain things are covered, certain types of drugs are covered here, certain types of drugs are covered here. Every Medicare prescription drug plan has its formulary and cost, that even down to drugstore providers and mail-in and many little options you've got there. The plan you choose, which pharmacy you choose, whether you get extra help. You know, you may have a Medicaid or other supplement that supplemental help that gets in there. So there's a monthly premium. In addition to your Part B premium, each plan may or may not have a premium if you're under an Advantage plan, right? Deductible and copay. You pay any deductible copay until your cost and the plan's cost reach $38.20. Then comes the donut hole, which, by the way, goes away in 2020. The coverage gap begins after you and your drug plan together have spent a certain amount for covered drugs. In 2019, once you enter the coverage gap, you pay 25% of the plan's cost for covered brand name drugs and 60% of the plan's cost for covered generic drugs until you reach the end of the coverage gap. That can be significant. Once you reach $5,100, you're out of pocket, the coverage gap ends and you go to a much lower copay. Right? Prescription drug plans, catastrophic coverage. Once you get out of the coverage gap, that $5,100, you automatically get catastrophic coverage. You only pay a small coinsurance amount of copay for covered drugs for the rest of the year. Not the rest of your life. Watch out. You thought I was going to say rest of your life. Rest of the year. What's the Plan D penalty? And your year is January 1 to December 31st, not your birth year, not your birthday. What's the Part D penalty? If you go more than 63 days without creditable coverage, you're going to get a penalty. It's 1% of the national pay. So it's maybe about, $3 and some odd cents a month for the. If you didn't do it, during that time that you had an open enrollment. If you go more than 63 days. So if you work for an employer and you work till you were 70 years old or 75 or something, or, so many of us today, our Social Security doesn't kick in until later. And maybe you worked until that later and you're 66 in 4 months, but you had coverage with your employer and you cancel that coverage within 63 days, you can get a prescription drug plan. Okay? You have an enrollment period because you retired out and changed your plan, and you don't have to pay that extra penalty. Got it? All right. Write your questions down. Stick out your piece of paper. All right. What drugs are covered? Contact the plan for formulary list. Plans may have coverage rules, prior authorization, quantity limits, step therapy. Opiates are a huge issue right now in the United States. So there's step therapy helping people get up and down. So you got to contact the plan, and before you lock into that plan, know what their current formulary list is. Now it may change, but you can get a feel for what this particular provider gives you. Here we are. Here's the summary page. Let's don't get too confused here, right? Part A is hospital insurance. Part B is medical insurance. That's where you start, right? Part D is prescription drug coverage. You want to get that. Part not any number D letter is Medicare Medigap supplement, and you've got it, right? Over here under Medicare Advantage plan, if you do Part A, you do Part B, then you pick Part C, and then you're under an HMO or a PPO or some restricted form of service, right? Then you want to make sure you got prescription drug coverage. It could be in that. It may be extra, and you're done. So it's a choice of which of these two. Some people just use original Medicare and don't do any of this extra. We can talk about that. We can talk about that because the Medicare Advantage plans many times are zero premium. If you don't have anything else, you're just there and you go, I don't anything, and I'm going to have to work just to make it. My Social Security doesn't have enough. No big checklist. I just wanted you to understand how this all works today. Is that cool? Basic Medicare Advantage, Medigap supplement, prescription drugs. You can send me questions. Phil, SolomonInsurance.com. Phil at SolomonInsurance.com. All right, we'll go to this next page. If we're here right in front of you, ask me questions right now. There I am, 405-388-8037. Call me up. You're going, well, Phil, what time zone are you in? Well, I'm in whatever time zone you're in. Just call me and I can either answer the phone or you can leave a message. Leave a message, please, so I can get back with you. Phil at SolomonInsurance.com. All right, you can go to SolomonInsurance.com and start playing around and thinking about this. I want you to have a great, great Medicare experience, right? That's the unexpected service. We want you to have a great, great Medicare experience. I don't know what that is for you. Whatever it is for you, I want it to be great, right? I care about you. I want you to have a great Medicare experience. Give me a call. Send me an email. Let's get connected. Have a wonderful, great day.